my first question, which was in the test, was on ASA classification, a topic which I presume very commonly being asked in different exams. And I hope one question would be from this topic because this is like so in topic nowadays. So question was, what ASA classification is assigned to a patient with severe systemic disease illness, severe systemic illness that is not encapsulating threat to the life. So which is not encapsulating threat to the life. So I know most of you must have done the right answer because I am discussing it so many times in most of my question answer section. So let us little bit talk about ASA grading. So what is this ASA grading? ASA stands for American Society of Anesthesiologists Grading, right? It stands for American Society of Anesthesiologists Grading. And this tells us about the risk associated with surgery. So it is telling us the risk associated with surgery. We have 6 ASA grade. We have grade 1, grade 2, grade 3, 4, 5, and 6, right? And what is happening from grade 1 to 2 to 2 to 3, 3 to 4, 4 to 5, 5 to 6? The risk is gradually increasing. So what is ASA grade 1? ASA grade 1, patient doesn't have any systemic illness. So no systemic illness. Patient is a healthy patient with no systemic illness. ASA grade 2, patient has mild to moderate systemic illness, which is not causing any major limitation on the patient's day-to-day activity. Mild to moderate systemic illness, right? Mild to moderate systemic illness. ASA grade 3 is your ASA grade 3 is your moderate to severe systemic illness. Moderate to severe systemic illness, right? Okay. ASA grade 4 is incapsulating systemic illness, incapsulating or life-threatening systemic illness. Okay. So life-threatening systemic illness, which is not compatible with life. So guys, let us just first talk about 1 to 4 ASA grade. Mostly the questions are from 1 to 4 ASA grade. So question is, patient has a severe systemic illness that is not encapsulating threat to the life. So severe systemic illness, but it is not encapsulating or life-threatening. This is ASA grade 3. So in the option, number C is ASA grade 3. So C is the answer. Now remember guys, ASA grade 4 is different from ASA grade 1, 2, 3, 4. ASA grade 4 means that surgery is the only option for survival. Surgery is the only option for survival. Okay. So ASA grade 4 patient, a 5 patient, if I don't put them for surgery, the patient will definitely die. So whatever chance the patient has, if the surgery is successful. So in desperation, I have put the patient for surgery, but the risk is very high. ASA grade 6 is entirely different from all the rest of the ASA grading. It is comatose patient for organ transplantation. So ASA grade 6 is patient who are brain dead. Brain dead. Okay. So brain dead or comatose patient for organ transplantation, whom we keep for organ transplantation. So again and again, I'm saying, guys, ASA grading is very important. They are asking what is ASA grade 1, 2, 3, 4 very frequently in the exam. So my word for it, question can be asked. Now, if they form a new question from this topic, what could be a new question? So the new question could be that which ASA grade is not taken for elective surgery. Then remember, till ASA grade 3, we take the patient for elective surgery, but ASA grade 4, we do not take immediately for the elective surgery. First, we optimize, then see the risk-benefit ratio. If benefit is more, then only we take the patient for surgery. So ASA grade 4, without optimization, is never taken for the elective. Elective means planned surgery, right? So ASA grade 4 is never taken for planned surgery if we have not optimized the patient. Once we have optimized, we see the risk benefit ratio and then take the patient for surgery. Got it? So this was my first question. Coming on the second question. Now, second question is again from pre-anesthetic evaluation and a very, very expected subtopic of pre-anesthetic evaluation, Nil Per Oral guideline. Nil Per Oral guideline, okay, which we put the patient on prior to elective surgery.